I'm responsible for a program that is in the northwest part of South Carolina. It's a Medicaid primary care practice, approximately 18,000 patients, and we cover around 3 counties in the upstate. The program itself is a residency clinic, so we have somewhere around 45 residents. We have 14 to 16 attendings and about 65 employees. We provide services for primary care services. We see children with ADHD, with normal primary care needs, and then we have our asthma action team. In about 2008, we began to have a vision of putting together a medical home in the upstate. The focus was going to be on children who we saw who were frequently visiting the emergency room and who were being admitted to the hospital. So we selected at the time, we wanted to pick out a diagnostic category that we felt like we could have an impact on, so we chose asthma. So expanding the primary care practice was the first move that we made. Then it became pretty obvious to us that we can't fix all of the children's problems in the clinic or in a physician office, so we began to engage the community. The next thing that became obvious to us is that if we're engaging the community and we're trying to coordinate with all the different parts of the hospital, that it was essential that we begin developing a communication method that would allow us to really know where the patients were. So often we serve patients in primary care settings and they could have gone to the emergency room, they could be admitted, but we don't know that unless someone were to send us a fax or a telephone call. So we implemented a system that allowed us to receive alerts, daily alerts on where our children were, so that we knew if a child was admitted to the hospital or was in the emergency room, so then we could follow up. And this is where we began to develop what we call our asthma registry. And right now that's around 4,500 children that we serve. We stratify those children. Red meaning these are children who we really need to be seeing frequently. Yellow, children we need to monitor. And green, children who are really not having issues at this time.
We realized that a number of children in the community were suffering from issues with their asthma without a lot of good follow-up. So we came up with the Asthma Action Team, which addressed issues for emergency room visits. It addressed school visits, home visits. We have partnered with several community agencies to help these children get a better quality of life and better control over their illness. The impact that the program has is, for us, most striking by the decrease in the number of emergency room visits for our children that have been identified with asthma. We actually have decreased the numbers almost in half over about a 5-year period. Additionally, by being able to go into the schools and the homes, I think we've really made an impact on those children in terms of their quality of life. We're able to provide things to help their environment, mattress covers, help the parents with insect removal, things like that, and then hopefully increase their ability to stay in school if they're having some issues with their asthma.
We have many partners, but the biggest impact that we think that we can have is when we work collaboratively with our partners. And we have a comprehensive program, but we tailor it uniquely to each individual. One of the ways that we do that is we work with consistent messaging across the continuum of care. We share the same visions with our partners and we share the same resources. One of the things that we do within our clinic is we have developed a Pictorial asthma action plan. Many people have just a generalized asthma action plan, which follows a stoplight routine, red, yellow, and green. But with our population, we found that many of our patients and their families and their caregivers could not, in particular, read, but not if they couldn't read. We wanted them to have an actual visualization of their medications. So we place the picture next to the name of the medication so that they will know what to do during that time period. And we use that asthma action plan not only in our clinic, but we use it in the home and throughout the community, like for instance in the daycares and in the school systems.